For today's Throwdown Thursday, we have Dr. Rahman with us. He's the plant pathology extension specialist here at West Virginia University Extension. Going to talk to us about an issue that's probably not too big in our gardens right now because we're just getting them planted, but I'm sure will become more and more relevant as the season goes on. Some of the diseases that we can see and ways we can identify and control them. So, Dr. Rahman, I'll let you take it from here.
Thanks for the introduction. And I am also the director of WVU Plant Diagnostic Clinic. So that basically means, when our county agents are not able to determine any disease issues or make any recommendation, then they send the sample to me in the diagnostic clinic. I make the diagnosis and send growers the recommendations. So most of my recommendations based on integrated disease management. That means it's not only dependent on chemicals, but also other options. But when growers are not able to control it with all other alternative options, obviously chemical is the last resort. So, in this short presentation, I'll show you some general diseases and how they occur, and what are the causal agents, and some major principles for controlling them. So this is a slide. This is a schematic from our professional society, American Phytopathological Society. So this schematic is basically to show you that plants can get sick, plants can get disease, not only on one part of the plant, but also starting from the root system to all the way up. So you can see here, just showing many different diseases. So once again, this is a schematic, so it's not real disease issues. Obviously, at the right-hand side here, you can see another schematic that is showing many different types of diseases, also almost 40 diseases. So diseases will not occur on one plant or one tree at the same time, like what we are showing here. In some cases, you see one or two diseases. In some cases, probably more than two or three. And here, here you can see the parts of our plant or tree. The above ground part, we call it foliar or foliage, stem, leaves, and also fruits. And whatever underneath the soil, of course, we say it's soil, below ground part. And the diseases can also affect the root system, and we call them soil-borne diseases. And on the above ground part, we call them foliar diseases. So if you have, harmful microbes in the soil, I'm not saying all the microbes in the soil are harmful, but there are some microbes in the soil that can cause problem on plants. So those microbes usually infect the feeder roots first and then go inside, and it can go all the way up to the crown area and then basically clog the vascular system of the plant. So when the vascular system of the plant is clogged, the nutrient and water and it cannot go up. Even that can cause the whole plant to wilt or dry up. So the consequence of soil-borne disease can even be higher than the foliar diseases. On foliage, if you see one or two diseases on a leaf spot or something, you can remove those leaves. You can remove probably one twig to reduce the inoculum load. Or inoculum means that's the part of the pathogen that can cause disease. So, but at the same time, when you have the root system infected with some disease-causing organism, if you remove the root, basically the whole plant is gone. That's why I said the consequence of all soil-borne disease is higher than the foliar diseases. So when we are talking about, especially when you are just at the beginning of your plant growing experience, I would say plant diseases, identification of plant disease can be a little difficult. And if you know some of the normal and abnormal growth of plant, then it becomes easier to say, okay, I'm seeing something unusual, abnormal on my plants, and that may be something due to disease. But in this slide, I'll give you a second to think about all these three photos. Left-hand side one is miscanthus, miscanthus sinensis, and at the middle you can see golden euonymus, and then at the right-hand side is rose. So when you think about the left-hand side one and the middle one, it doesn't need an experience with growing plants, but you may have seen it. These are called variegated variety of these crops or ornamental plants, right? But at the right-hand side, when you look at the rows, how many times you have seen it? Not too many times. So it's probably something unusual. And this is caused by actually virus we call mosaic or mottling of rows. So this is something unusual, and we will call it a disease. So once again, any condition in a plant that interferes with normal growth and development. So if you are growing plants, you started growing seedlings and then taking it to the field or your garden, and then plants are growing normally what they should, then they are probably healthy plants. But anything you see unusual or abnormal, that will be the disease. And it is very broad definition, but here in this slide, you can see at the left-hand side, these are all tomatoes, okay? At the left-hand side, you can see this tomato plant is showing some kind of twisting or stringing or curling. And in some cases, you can see also distortion or strapped up, cupping of the plant leaves, or even some of the, stems. So this is obviously not normal. I don't need to tell you that is it normal or not normal. Obviously, you can see this is not normal. And at the middle of the photo, you can see one tomato is rotting from the end, and you may have seen it. If you have grown a few tomato plants, it is not uncommon, but it is, like from the rotting at the end. So we call it blossom end rot because you can see the blossom side of the fruit is rotting. So, and at the right-hand side, what you are seeing, this is very, kind of disheartening because you can see these plants with some green tomatoes and they are wilting or drying up. So what is happening here? So drying up means that water and, like I mentioned, water and nutrient cannot go up. But the reason is that some organism, some pathogen infected the root system and it colonized the root system, and then plant is not able to uptake water and nutrient. So what is the result of this? You can see at the left-hand side one is, we call it unregulated growth. In most cases, herbicide injury can cause this. Nowadays, people are using lots of growth regulator type herbicides for controlling weeds in their lawn and also in some cases in their garden or around the garden. So these growth regulator type herbicides can cause problem on plants, not only in one way, but in many different ways. If they can form, even if you are not using them directly on the plant, they can cause fume. That fume can cause injury on plants. And at the middle one, so I will say, if you are using growth regulator type herbicides, you need to be careful not to bring it close to the solanaceous plants. So solanaceous plants are tomatoes, potatoes, eggplants, and many other vegetable crops we grow. And in the medium blossom end rot, it is caused by calcium deficiency, which is an essential plant nutrient. So calcium deficiency is more commonly seen on plants, especially on fruits, for many different reasons. So it's not only the cause that your soil is deficient of calcium, but the real point is calcium is not, or plants are not able to uptake calcium in real time, especially when the fruits are, expanding or, growing very fast. When the cells are dividing, the cell walls will have to have steady supply of calcium nutrient, like with other nutrients. And calcium cannot remobilize within the plant, so it needs a steady supply. So if your soil is not having enough moisture, and then plants are not able to uptake nutrients on a real-time basis, then you can see this problem. But if you can maintain enough moisture in the soil or in the field capacity, you should not normally see this problem. And obviously, you have the option to add calcium in the soil, or even sometimes at the flowering stage. So we'll be mostly talking about the fungal or bacterial diseases. This one is a bacterial disease caused by Ralstonia solanacearum. It is in the soil. So for small growers, like the best option for them when you are seeing some problem in the soil and a combination of host, that is the plant, you should not basically grow the same plant in the same area in the next year or so. So that is called rotation. And how you do the rotation? Basically, you bring the plants from a different family, okay? So let's try to familiarize ourselves with the causal agents that can cause problems on plants. So the two major groups, abiotic, that is non-living or environmental factors that can cause problems on plants. What are those? Nutrient deficiency or excess. If you have too much nutrient, that can also cause problem. Obviously, if you have less nutrient, you will see the deficiency symptom on plant. And other environmental factors like drought, freezing, excessive temperature, ultraviolet radiation, pollution. These are some common examples of environmental factors that can cause injury to plants. And also, you probably need to be mindful about what kind of soil pH you have in the soil where you are trying to grow your plants. And not necessarily all the plants like, pH 6 to 7. There are some plants, acid-loving plant like blueberries. So if you see something wrong with your blueberries, and you can see it's called interveinal chlorosis, not necessarily it's a biotic disease, or it is not caused by fungal pathogens or bacterial pathogens or virus. It can be caused basically by just soil pH is not right for growing blueberries, okay? This is 4.2 to 5.5 is optimum. So just to make sure that you know that 50% of the all plant problems are caused by abiotic or environmental factors rather than biotic agents. So we said fungi, bacteria, nematodes, viruses, and phytoplasma. So even within these biotic causal agents, fungi or fungal pathogens cause like 75 to 75% of the most biotic diseases on plants. Here at the right-hand side, you can see this is a biotic disease or fungal disease, which we call early blight of tomato. So how you identify these? Of course, these are all microbes, right? These are very, very microscopic organisms. You cannot see them without a microscope. But what you see on the plant, those are basically symptoms. Those are not the signs or the causal agent. These are the symptoms that due to infection by these causal agents, biotic agents, the changes in the plant, they can kill the plant tissues. They can cause some kind of certain symptom. Those symptoms we are actually utilizing to identify the diseases. So here you can see, if you take a closer look, you can see those concentric rings on these lesions, and those concentric rings are basically formed by this fungal pathogen, Alternaria solani, and we call the disease early blight. In most cases, this disease can come relatively early in the season of tomato production. So we really need to understand what are the predisposing factors and what are the environmental factors. And by analyzing these three different factors, okay, you are growing the plant in an environment, right? It can be your greenhouse environment, it can be your high tunnel, it can be your small garden, it can be your large field, whatever. This is the environment where we are growing. And obviously, if it's an outdoor environment, temperature, rain, and other things is not within our control. So there are some environmental factors that favor the, especially fungal pathogen, to multiply very quickly. We call them favorable environment or conducive environment, okay? And host is the plant that you are growing. So there, it can be two different types in terms of susceptibility or sensitivity of that plant to these pathogens. We call them either resistant or susceptible. So just to make sure that when I'm saying resistant, don't take it as immune. So there is no plant variety that is actually immune to pathogens. So resistant means they will still get some disease, but the loss from the disease will not be that high, okay? And one other factor is obviously the pathogen that can cause diseases on plants. So here you can see these three factors are interacting, and these three big circles, when they are interacting, the overlap of these three factors determines the disease. So always keep in mind, you have to have susceptible host, you have to have the disease-causing organism or pathogen, and you have to have the favorable environment to get the disease on plants. If any of these are not within this limit, plants will grow just normal. Even if you have susceptible host, if you have the disease-causing organism, but if you do not have the favorable environment or conducive environment for the disease development, your plants will do just fine. And even if you suspect you have all three different factors, you'll see in my last slide, try to manipulate one. If you cannot do it in the current growing cycle, you should learn something that you can utilize in the next growing cycle to manipulate this disease triangle, okay? What are the important environmental factors? Leaf wetness. Leaf wetness means how many hours the leaves of the plants or the foliage remain wet. It can come due to rain, from the rain, cloudiness, relative humidity, or dew. And even if you are sprinkling water on your plants, that can keep your plants wet for 6, 7, or 8 hours, especially in a cloudy day. So always keep in mind, if you keep your foliage wet for prolonged hours, that can cause conducive environment, especially for fungal diseases. So if you have to sprinkle water, I will say don't sprinkle water on plant. Just take your hose, take the hose next to the soil root, so next to the soil line, and then water the plants. Keep the foliage dry as much as you can. So biotic diseases, especially for fungal diseases, you can see once again, another schematic, this fungal spore has landed on the plant leaf tissue on the plant, outer side of the plant. And this, in the presence of this blue area, that's a tiny water droplet on the plant. So this spore will germinate. You can see it will form the germ tube and aprisorium. In some cases, in some fungal diseases, it's obvious that exert pressure to go inside, and then it can eventually grow within the cell and in between the cells. At this situation, there are thousands of molecular things happening behind the scene when a fungal spore trying to invade the plant or plant leaf. And that determines whether that fungal spore will successfully go inside and cause disease. But successful ones will be able to produce toxins and kill some cells. And when thousands or more cells in that area is killed or dead, then we see a tiny, tiny lesion or spot. That is the disease. Okay. So here you can see once again for tomatoes, we are seeing in most cases 3 different major foliar diseases. That means those are caused on the leaves, or in some cases on the stems and fruits. Okay, the major one for us is septoria leaf spot. You can see thousands and thousands of spots you will see on tomato leaf or leaflet. And in the middle early blight, you will not see that many lesions, and you will see those concentric rings. And in some cases, you will see some blackish areas that is caused by late blight or Phytophthora infestans. Okay, so I will just take a few minutes to describe this major issue on tomatoes. So here you can see someone has been trying to grow tomato in an open area. I mean, no mulch, nothing. And most likely he grew tomatoes in the same area year before, from where you can see these infected leaves or, with some major areas came on the ground. So here the whole leaf with some leaflets. So this is basically the inoculum source or the disease source for the next year, okay? So if you are keeping this diseased debris in the soil and you are bringing your tomato plant next year, you will obviously see from the low-lying leaves, it will be infected fast and it will keep going upward. So always try to clean the debris when you are done at the end of the season, and few other steps you can take that you can see in the next slide. Once again, the disease cycle, that means how the disease is coming from one season to another. You can see if you have those plant debris, in the spring, they will produce lots of spores and they will cause infection on the lower leaves. It will keep going up. And in case of early blight, it can go on the stem and it can go also on the fruits. And in some cases, it can come also on the seeds. And that cycle keep going. And in some cases, like I showed, some of the leaf or plant debris can come directly on the ground. So what you can do, these are the major steps you can take. Rotation. Tomatoes, you rotate area if possible for multiple years. Do not grow the tomatoes or potatoes in the same area. Certified or treated seeds, some of the resistant varieties we released, some of the slightly resistant variety, like 7 Oisbergina 63 is very susceptible to septoria leaf spot, but it has resistant to our late blight disease. So we bred some new varieties like 17A and B, and also you can buy Iron Lady that has some resistance against these 3 foliar diseases. Like I mentioned, removal of infected plant debris. Lower leaves, those are touching in the soil line. When plants are like a little bit grown up, you can easily remove this. Those lower leaves are not needed at that stage when the plant's in bloom. Use drip irrigation instead of sprinkler. Once again, I will try to emphasize on that basically facilitate quick foliage drying. Removal of weeds, especially Solanaceous one. And now, even if you are following all these options, cultural options, still you can see some problems because during the growing season, we have conducive environment because high temperature and relative humidity high. So if you are organic grower, you can try these products. Fixed copper, there are very different trade names, Regalia, Serenade, Actinovate. These are the organic products or beneficial microbes-based product. And also you have other options. like many different chemicals, like conventional ones, chlorothalonil, mancozeb, quadristop, ribastop, and tannose. So these are the very good chemicals that you can use to keep the disease under control. So I just wanted to show you one major disease if you have some grapes in most cases in our area, people try to grow concord, and that is very, very susceptible to black rot. So I took a project to make sure that we can actually keep the disease under control also, although we have very humid, growing season in the mid-Atlantic, still we should be able to keep the disease under control. This is a fungal disease. As you can see, the disease initially shows up on leaf, on foliage. And within the leaf, it produces lots of fruiting bodies. We call them pycnidia. And within the pycnidia, there are lots of fungal spores. Those are basically moving on the grapes and then cause them black rot, cause the disease black rot on them. So lime sulfur is something that you can use at the time of pruning. So if you have this, pruning is an essential step you have to take for perennial plants or vines or whatever you have. So when you are doing the pruning, it's not only revitalizing the plants, you can also remove the infected areas of the plant. So, and then after that, you can use lime sulfur to clean up the remaining inoculum source. And so this lime sulfur has to be used before the green tissues coming up or before the bud break. And after the bud break, when you have the green tissues, you can use any of these products like mancozeb, A-bound. So I need to tell you that I took this project like 2 years ago, and there are few growers are using this approach that I just mentioned to you. And they told me, and I even saw that when they basically ignored to harvest because black rot was so dominant, like 70–80% of the grapes were infected with black rot. And last year and the year before, they probably had some disease, maybe less than 5%. So you can see, just I'm trying to ensure you or assure you that if you want, you can keep the disease under control. So these growers, they used all these spray programs. And only one bacterial disease I have time to show you on apple. This is fire blight. This is an extremely dangerous disease for apple and pear. So what happens, this bacteria, Aeronia myelobora, that infects through the flowers, and it goes inside through the phloem and survive on the stems. And during the springtime, when temperature goes up, these bacteria start to multiply. And you can see some kind of oozing coming out. And these bacterial cells are being airborne, or some insects taking them to the flowers. So initial infection taking place in the presence of moisture and temperature. Okay. After the infection, those honeybees are inadvertently actually taking those infections, the bacterial cells, from one area to from one flower to another. So this is a bacterial disease. And you can see even the stems can be infected, and they will show you this specific symptom. We call it shepherd's hook or shepherd's crook. Basically, it will form a hook or crooked area at the end of the stem. That's why that is the most identifying characteristic of this fire blight. So this is a bacterial disease, and you cannot control it with fungicide. You have to apply either copper-based product or bactericide like antibiotics. So that's why I mentioned that you saw in tomato disease, copper can be used, and also bacterial disease, you can use copper. So this is the only one product that can be used for controlling both bacterial disease and fungal disease, okay? And there are some disease management options for small growers of our homeowners. There are some resistant varieties available: Liberty Red, Delicious, Empire, Enterprise, etc. And pruning, once again, I mentioned this. You can do the pruning. You can take the infected areas out. So it applies to all the diseases. If you see the symptom, if you see some abnormality in the plant, in the leaves, in one stem or twig, you can take it out. So that's basically will be part of your pruning. And prevention, antibiotics, agribamycin, fertilome, you can buy them in smaller amount too. For organic growers, once again, copper, double nickel, that's a microbial based product. Okay. So in the last two slides, I just want to talk a little bit about disease identification or diagnosis. I mentioned a little bit about what we are seeing is the symptom on plants. So there are two different things you need to give attention to: sign and symptom. Sign is basically the indication of disease from the observation of pathogens. In most cases, like I said, these are microscopic, so you will not see it. You will see basically symptoms, the changes taking place on the plant tissues or organs. What are those? Chlorosis, you can see some kind of rot, vascular streaking, cankers, that means sunken areas, leaf spots, galls and mosaics, leaf distortion, etc. And there are many different types of pathogens that can cause different types of symptoms on plants, but that is, that takes really lots of times in understanding what different types, like some disease symptoms you can easily identify, like powdery mildew. When you will see the kind of white powdery stuff covering the leaf, especially on cucurbits. And if you say, okay, identification, why is it so important? Because if you know this is powdery mildew, you can take different steps. You can apply sulfur, which is organically approved. And there are also some products, those are organically available, organically approved. You can apply those products early in the season. Just as the title is identification or diagnosis of diseases, I just wanted to show you that how you differentiate, first of all, normal and abnormal growth, right? And then you differentiate a biotic factor and biotic factor. If you are seeing some unusual weather event like frost, and it will affect all many different types of new growth. So if you see across different crop species, you will have to take that as a biotic factor, environmental factor causing that problem. And in many cases, we really don't have anything to do about it. So the whole idea here is to be able to differentiate these two factors, because in that case, you don't need to apply any fungicides or antibiotics or something like that, because there is really not much you can do. Abiotic disorders, that's why abiotic disorders always show some kind of patterns, maybe in one side of the area, or even the whole plant, all the plants in one area will be affected. On the other hand, if it's biotic disease, that means caused by fungi, bacteria, or some other pathogens, that will be caused by biotic agents, fungi, bacteria, or nematode or viruses. So the last slide. So I just wanted to show you that, once again, the disease triangle, these three different factors. If you want to control the disease, if you want to suppress the disease, you can manipulate one factor, okay? You can try to kill or suppress the growth of pathogen, or you can use resistant host, or you can try to make the environment unsuitable for the disease. All right, thank you very much. Any question?
We've put the link to the survey there in the comment section if anybody has any.
Yeah, you can I have also my email address in there. So if you have any question, or even during the growing season, if you see some plant showing any abnormality, you can send me photos. And in many cases, actually, that is enough for me to identify common diseases or common abnormalities in plants.
It looks like we did have two questions. Baxter, first one is, there are several plant health indication applications. Some are free. I'm assuming he's talking about phone apps, and some you have to pay to use. Have you found a specific app that you recommend?
Well, there are many different apps now available for identifying plant problems, but I specifically do not use any of them, or I do not endorse use of any of those, because in many cases it is a little complicated, and also you can get misleading information. These are still not 100% accurate. So I am not using any of those as of now.
And Baxter's other question here, it said, if I understood you correct, if certain maladies are evident across several plants in shared soil, would you recommend to pull those up now and plant in a different bed to avoid the same problem?
So plants have been planted in a bed, right? And they're showing some
That's what I'm
problems.
understanding.
And then you are trying to take them to a different bed?
I guess the question is, and Baxter, if you want to jump on and clarify, I guess the question is, would you recommend pulling the plants up and planting them in a different bed to avoid the disease continuing?
Yeah, no, actually, I was going on his statement on that next year or the next growing season, moving it to a different bed using crop rotation to try to avoid having the same issues that you had before. And that was my question. Like, if nothing I'm doing is helping it, is it just a good idea? Go ahead and just pull them up and, they're out of the way. They're not causing any spread of any further problems to any other plants in that area. And then just obviously, we had the soil testing, make sure to get our soil test out early to make sure pH and nutrients, so that perhaps when we rotate to a different bed the next growing season, we can avoid having the same issues when we had, say, tomatoes or eggplants or peppers in a particular bed, that, it wasn't just attacking, or the malady wasn't just like one plant individually, but it was seeming to happen to all of them.
Yeah, that's really a great question. Yeah, so but I was a little confused about pulling them up. So you don't really need to pull them up in the same growing season, because soil-borne disease control takes whole different approach. If you are seeing any disease issue that may be relevant to soil, or soil pathogen, you cannot do much for the current season. So in the next season, obviously, the rotation, and then in a different bed. So rotation means you have to try to grow them or move them away from the problem area. How far you can move away, that really depends on how much area you have. I always recommend the farthest you can take them in the next growing season. And also, probably in the same area where you are seeing problem on tomatoes or solanaceous plants, you can still use the same area for plants from a different family. You can grow cucurbits, you can probably grow some crucifers, because these diseases are some way specific to crop families, so not the same organism. There are some common, but still, they are not huge problems. So you can bring plants from other families to grow in the affected area or problem area, and then take your crop that is now being infected in the next year to the farthest area possible.
Thanks for your question, Baxter.
That's a good question.
Thank you.
Yeah.
Anybody else before we sign off? Well, hearing none. Dr. Rahman, thank you so much for joining us today. And everybody, fill out that survey, code word fungi, and earn some points for your county.
Thank you.